Hi, my name is Brett Cushing here with Nystrom and Associates. I'm a psychotherapist here and trained in trauma therapy. And I'd like to talk with you a little bit about trauma therapy. Trauma is a fact of life. It happens. In fact, 3/4 of Americans have experienced a traumatic event, and about 7% of our population are diagnosed with post-traumatic stress disorder. And it is quite prevalent, but it also has quite a profound effect upon us all. See, when trauma happens, for instance, when it happens in children, it affects them deeply. In fact, it can negatively affect their development. It can also further contribute to at-risk behaviors later in their teens. And it also can affect us as adults, because if we haven't dealt with that trauma, it tends to stay within us. It doesn't just sort of evaporate and go away. It sort of lingers, and it lingers in the body. And here's why: because traumatic memories are stored differently in our memory. So for instance, we have long-term memory, right? And that's kind of like a bookshelf. You can go to a bookshelf and you can sort of pull off a book and just read it, no problem. And our long-term memory is a lot like that. We can go to long-term memories, the summer of 1992, and sort of say, oh yeah, I remember that. That was a lot of fun. However, traumatic memories are stored differently. They're not stored in long-term memory. They're actually stored in active memory. And that means when we go back to those traumatic memories, we're not just retelling the trauma, we're reliving it. We are re-experiencing it. Those emotions, all of that intensity that we experienced when it originally happened, because it's stored in active memory, we are not just retelling it, we are reliving it. This is really captured well in a book, The Body Keeps the Score. And in that book, the author highlights how trauma has a comprehensive effect upon us, not just our emotions, but also our perceptions of the world, in our relations with other people, and even in our own bodily functions. So how do you know if you or somebody is having a difficult response to trauma that you've experienced? Well, you are likely to see experiences of self-medication. People who have had trauma try to dull the pain through self-medicating with drugs. They also can have eating disorders, attention problems, emotional regulation problems, and feel a sense of vulnerability in relationships. We tend to relive the trauma as well through intrusive thoughts and through reliving the experience in flashbacks and nightmares. We also may find ourselves avoiding trauma-related people or places or events, and we might not even be able to recall the trauma, but we know something happened in a general sense. Lastly, another symptom is we tend to have different kinds of responses, maybe an exaggerated startled response. So instead of just sort of being a little bit startled, we're really startled, and it's sort of exaggerated for us. And that's because of that active memory. It's stored there. We also can be highly irritable. In addition to that, we tend to be hypervigilant. We can walk into a room and sort of see everything and everybody, and we're very much aware and attuned to everything going on around us because we don't feel the world is safe. Now, there is hope. There is treatment for us. Here at Nystrom Associates, we have many therapists who have been trained and are adept in providing prolonged exposure therapy, ART therapy, ART therapy, that is. I'm trained in EMDR therapy and sand tray therapy. All of these can be very helpful ways to find hope and healing for these very difficult traumatic events. Maybe in just this short little quip that we have here on video, there's one tangible takeaway that can help us and help everybody else around us. You know, when we become intolerant, it's a lot of times because we don't understand things and we don't understand people. For instance, we see somebody's behavior and they might have emotional regulation problems. They may not feel very safe with relationships. And it's easy when we don't understand to become intolerant and ask, what is wrong with him or what is wrong with her? Hopefully, as we understand just this little bit already about trauma, we can pivot away from that intolerant question of what's wrong with him to a more compassionate one of, I wonder what happened to him, or I wonder what happened to her. And in light of that, hopefully, we can be motivated to be patient with everybody because we are all struggling with something.